Birth control pills. So what are they? Oral contraceptives are pills that contain hormones that alter your body's hormonal cycle. There are two types of oral contraceptives: combination pills, which contain estrogen and progestin, and the mini pill, which contains only progestin. How do they work? Pills usually come in packs of 28 pills. You take one pill every day at the same time each day. The fourth week of your pack of pills is usually inactive or placebo pills. They don't have hormones in them. They are just used to keep you on track and ensure that you are taking a pill each day. During this fourth week, you get your period. Birth control pills keep the egg from leaving the ovaries. If the egg can't leave the ovary, it can't meet with the sperm. The progestin in the pills makes the cervical mucus thicker, which prevents the sperm from entering the uterus. When can you start taking them? You can start taking the combination pill at any time of the month, but if you start it within 5 days of the start of your period, you are protected from pregnancy immediately and do not need a backup method of contraception. If you start it at any other point in your menstrual cycle, you will need a backup method of contraception for 7 days. For the mini pill, you can start taking it any time in the month. You will need a backup method of contraception for 48 hours after you take the first pill. How effective are they? Oral contraceptives are extremely effective. The perfect use failure rate is 0.3%, but this only applies when you take the pill every day at the exact time. Typical failure rate is about 9%. Some tips to remember to take your birth control pills on time is to set an alarm so you take it at the same time each day, or take it when you do a daily activity, such as brushing your teeth every morning. What are the costs? Costs vary depending on the type of pills you are using. The cost can range from $25 to $60 a month. However, there are student health centers on college campuses that offer free family planning services, which saves you a lot of money. Watch this short video for more information.
Okay, so there are two types of oral birth control pills. The most common type is known as the combination oral pill, which is a combination of two hormones, estrogen and progestin. These hormones are already found and produced in the women's ovaries, but the increased amount of hormones stops the development and release of the egg from the ovary. The second type of pill is also known as the mini pill, and it contains only one hormone, progestin. This helps suppress ovulation and prevents the male sperm from reaching the egg. So the pill is up to 99% effective, provided that you take it at the same time every single day. If you do forget, take it as soon as you remember. If you don't remember till the next day, take 2 that day. You're also given up to 7 placebo pills, or pills without hormones, that you take during your period. So the pill goes into effect 1 month after you first begin taking the pill, and fertility resumes a few months after you stop taking the pill. Again, this can completely vary from girl to girl. Either way, you need to consult a doctor because the pill comes with many side effects that affect each girl differently based on your medical history. Also remember that the pill does not prevent against STI or STDs, so please use a condom for that.
Some of the advantages are that the pill is very effective when taken correctly. It is safe for most women. It may decrease menstrual cramps. It regulates monthly periods, treats acne, decreases risk of ovarian and endometrial cancer, easily reversible. You can get pregnant soon after you stop taking the pills. You still get your period every month. It provides protection against bone thinning, protection against ectopic pregnancies, protection against cysts in the breast or ovaries, and protection against serious infections in the ovaries, tubes, or uterus. Some of the disadvantages are that you have to remember to take it every day, and sometimes you may forget. There's possible weight gain, spotting between periods, nausea, headaches, and depression, higher potassium levels, which may lead to heart conditions. It may reduce your sex drive, no protection against STDs. Some of the more severe risks are heart attack, stroke, blood clots in the legs, lungs, heart, or brain. And the risks are also higher if you are over 35, are overweight, smoke, or have high blood pressure. How can I get these birth control pills? Well, they are not sold over the counter. You need to see a doctor at a Planned Parenthood clinic or a private office for your prescription. Once you have your prescription, you can get it filled at any pharmacy. Remember, birth control pills do not protect against STDs, so you always have to remember to use a condom. And these are my references.